evening, good morning to wherever you are in the world. Today we're going to be looking at medical in the context of aviation, what we have to do, what our responsibilities are as flight deck crew, working with cabin crew in managing medical problems that do occur and can occur on your flight deck. So we're not looking at this in the perspective just of the ICAO exams. We're looking at this in real life. More or less, this can happen on your flight deck. What are you going to do? What procedures are you going to follow? What vocabulary do we need to understand to actually get through and make sure that we can perform our number one responsibility? Our number one responsibility is, as you may recall, the safety of the flight, including the crew and the passengers. Why do I say the word crew first? Because if I got a problem with a passenger, the passenger sick, a passenger drunk, whatever, my primary responder is my crew member. Therefore, my first question in any situation to my crew is, are you okay? What type of assistance do you need? I'm there to help you. That is what a captain's job is. So we're not just flying the aircraft. We're now also responsible for the lives of all those passengers and crew behind us. So we have to make the right decision. Also, there is a legal responsibility. I'm the captain. So if a crew member comes to me and says, Captain, I've got a problem with a passenger struggling to breathe, guess what? It's now my problem. I have to make the correct decisions. The company looks to me to make the correct decisions. Moving in. So what we see that if we look at the United States as an example, all right, of what can happen on an average basis, what we actually see is that in-flight medical emergencies are increasingly common. Why? Journeys are getting longer. Okay, I'm flying Bogota to Madrid. Something can happen on my flight. Got an older passenger. And what we're seeing is, on average, there is one emergency every 604 flights, 604. So if we take that back to wherever you are in the world, in your airline, in your country, medical emergencies are happening and they're increasing. So we need to be able to answer that question. The most frequent medical issue is loss of consciousness, followed by difficulty in breathing, nausea. Oh, I feel sick. I think I'm going to vomit. We call that nausea. And heart problems. Passengers having a heart attack. A passenger has gone into cardiac arrest. So we need to understand this vocabulary to know what to do. Obviously, we have our primary responders, our flight attendants, our crew members. And normally, if they need assistance, they're going to look for a doctor on board or maybe some other type of assistance or medical care assistance. We live in a world of pandemic right now. So the exams are modern. They're updated completely. For example,
Situation 2.
More of our passengers are feeling ill. We think it could be some kind of virus.
Captain advising that more, not few, of our passengers are feeling ill. We think it could be some sort of virus. So that's a short audio. But then again, if I was asking questions, how many passengers? What's the problem? We need to get into the detail to understand so we can make the correct decision. The decision for me on the flight deck is quite simple. Do I continue to my destination, or do I need to go to the alternate? If I go to the alternate, Do they have medical services to meet me on arrival? So I'm going to be checking with ATC that there are appropriate medical services to meet the aircraft on arrival. That's important. On the flight deck, we have to understand the problem and communicate the problem in English. We need to ask questions so we can give advice. Medical emergencies on flights are relatively uncommon, but they do happen from time to time. And we've got limited access to medical equipment and potentially longer times to reach, the destination where we can get medical care for the passenger. So our crews, our flight attendants, are trained in basics to deal with different types of situations. So what do I need to know? As I just said, based on the information received from the cabin crew, listen to that, based on the information received from the cabin crew. Translation, Captain, we got a problem. There's a passenger having a heart attack. Boom. What questions do I need to ask? What advice can I give as the captain? It's my decision. I'm responsible to the company legally as to whether I divert the flight or I continue. So I need to ask questions. This is real. This is not an ICAO exam. I need to ask questions to determine what I'm going to do, because now I have a passenger's life at risk, riesgo. So I need to know what to do. So what do I need to know? I need to know how urgent is the situation. Is an immediate landing required, or could a more suitable but further diversion be considered? I also need to know what services will be required. I need to check the NOTAMs to make sure that medical services are available. I need to make sure that I've got medical staff to meet the aircraft, ambulance, hospital, any specialist facilities. Or maybe I need to go to another alternate that way around. This is the information I need to know when I'm actually making a decision. So what type of problems am I going to face?
Situation 2.
We have a situation. We're worried about the pregnant passenger.
That's a good one. Where is the passenger located? What exactly is the problem? What is her condition now? Does she need immediate medical attention, or can we continue to the destination? Those are the type of questions I'm going to be asking in real life, not in my ICAO exam. And I'm a pilot, I'm not a doctor.
Situation 2.
We need some help. My colleague is diabetic, but does not have his medication.
Why is it the captain gets all the problems? That's the way it is. So, okay, your colleagues are diabetic, doesn't have his medication. Okay, what type of medication does he require? Do we have that medication on board? Have you checked the first aid kit? Do we need to call the company? Do we need to divert? There's all sorts of things rolling in my head that I need to be able to ask so I can make a decision. Also, what are the type of questions I'm going to ask? So let's pretend for a minute this is questions and advice. What sort of emergency is occurring? Where? Now, the most important thing, and don't get me wrong in this one, is that let's try and create a formula that works for every type of medical situation. I mean, logic. When I say the word formula, I mean logic. What do I mean? So, what specifically is the emergency? And what do I really need to know? Let's face it, I can only ask 4, 5, 6 questions in 20 seconds in an exam. What do I really need to know? Captain, there's a problem. There's a passenger having a heart attack. Don't immediately go to, is there a doctor on board? Because you'll block. What do I need to know? Where is the passenger located? Front, aft cabin, in the toilet? Can the passenger breathe? Has the passenger eaten or drunk anything? Can they tell you the problem? Can the passenger wait until destination? Do we need to divert to an alternate? What's the condition of the passenger now? Sometimes in these exams, we try and think too much, all right? But the idea is if you think too much, you're not going to give me relevant questions because I need more to get a higher result. So we need to adapt a logic. You know, is the passenger traveling alone, you know, or with family? Other questions that we can ask that we'll look at today. The idea is if you want a level 5 or a level 6, I need at least 4 or 5 relevant questions, not 2 or 3. That also shows that you can respond rapidly, that you have logic, that you can think. Again, what do I need to know? I need to know if I'm going to divert or not. So in my mind, one of the questions I need to be asking is the passenger, as we see here, is the passenger getting worse, okay, or deteriorating? If they are, I'm going to divert to the alternate medical assistance on arrival. Check they got medical assistance on arrival. If the passenger's stabilizing or improving, okay, maybe I can continue. And of course, either way, do I need medical services when I arrive? So these things become important to me in my planning.
Situation 10.
If the passenger's breathing doesn't improve in the next 5 minutes, we'll begin our descent.
That's what I'm thinking. What's the captain saying in the audio? He's going to start his descent if the passenger's condition, his breathing, doesn't improve in 5 minutes. Let me know. Okay. So what I want to do now is take a little look. I'm going to take you inside a flight deck. All right. 767 Boeing. In walks the flight attendant as I'm flying the aircraft. Or I should say a colleague is flying the aircraft. All right. All right. A colleague is flying the aircraft. So what questions would I ask? Okay. What questions would I ask in that type of situation? Take a look. This is real.
248, we see you passing flight level 180. Descend and maintain flight level 140.
Descend and maintain flight level 140. Suspend 248.
Captain, I'm sorry to disturb you, but we've got a problem with passenger in 2B. She's complaining of chest pain.
Suspend 248, just see your rate of descent.
Currently 2,000 feet a minute, suspend 248.
Roger, that's okay at present. Suspend 248.
248.
What's the problem?
She's complaining of chest pains, but her medication's in the hold in her baggage. Just wondered if
Suspend right turn now, heading 240.
Right, heading 240, suspend 248. 240 on the heading.
Do you know what the matter with her is?
No, she's just complaining of chest pains. The chief steward sent me up to see if there's anything we could do.
Are we going to chase or feeder?
Suspend 248, reduce speed 250 knots.
Reducing 250, suspend 248.
Nikki, what's the problem?
She's complaining of chest pains, but her medication's in the hold.
Do you know what this
Suspend
medication
248,
is?
are you VMC or IMC currently?
Say again, suspend 248.
Are you VMC or IMC at present?
We have VMC on top, suspend 248.
Roger.
So you don't know what this medication is?
No.
She's just got a pain, and the CSD sent you up.
Yeah.
What do you actually need from me?
Just see if there's anything we can do, if anything we think we can do about it.
Well, I suggest you go back.
Suspend 248. Turn right now, heading 280, descend flight level 120.
Heading 280, descending 120, suspend 248. Heading 248, 280, 280.
Go back and find out what the matter is with this
Suspend
passenger.
248. We anticipate a hold at the next fix. Can you take 15 or 20 minutes?
Suspend 248, A firm.
Roger, and in order to do that, reduce speed further to 220 knots.
Reducing 220, suspend 248. Get the speed back, will you?
Listen, will you go back, speak to the CSD, put a call out for a doctor, find out what the matter with the passenger is, and find out what the name of this medication is, and then come back to me, will you?
Okay.
Okay?
Notice that the closing advice of the captain was, come back and tell me, update me. So what he's basically saying is what I would say is monitor the situation, keep me advised. So we're asking questions to determine what the conditions are. If the condition is getting worse, we need to determine the course of action. Always check if conditions change, get an update, then give advice, monitor the situation, keep me advised. Note we can also use words like weakening, deteriorating, worsening to also describe the medical condition of the passenger. It's important to always get an update. So this is what we can say in the exam. Monitor the situation, update me.
48. Get the speed back, will you?
Listen, will you go back, speak to the CSD, put a call out for a doctor, find out what the matter with the passenger is, and find out what the name of this medication is, and then come back to me, will you?
That's the captain. I'm helping you out, monitor the situation, keep me advised. Let's use that in our exam.